Everybody, our daily briefing on where we are and how the impact of the COVID crisis. I'm here with Josh Jabal, who's been helping lead our efforts here, and Beth Bai, Office of Early Childhood, will be on in a few minutes. But first, let me go over some of the current numbers. We have 874 people tested positive. That's out of 2,350 tests. Again, the number who test positive is less relevant because that's impacted by the number of tests. You see our testing bounces around a little bit but continues to ramp up. I think the numbers that are of particular interest to me, and I think the key metric, as I've said now for a while, is hospitalizations. We added 87 more net people hospitalized, net meaning people going in versus those who are being discharged, taking up to a total of 1,308 hospitalizations. Let me tell you what that means. That means, as I've said before, we thought the number of hospitalizations, that could have been the surge, that could have been the apex, is what could have really put our hospitals under extraordinary stress. And that's why we instituted very strict social distancing measures early on, a month ago. And it is paying some fruits of that. And the fact is that 87 hospitalizations, we've averaged about 90 or so over the last 5 days. 5 days does not make a trend. My friend, Dr. Jabal, he keeps reminding me, but 5 days is 5 days. And the week before that, there were about 102 hospitalizations. So at least we can say we're seen to be flattening out. And what does that mean? That means it gives our hospitals more capacity. It gives them more time to plan. It gives them more time to make sure that we have ventilators and people in ICU rooms for you. It means that peak may be somewhat mitigated, only thanks to your strict social distancing. I got to tell you enough. This is no time for happy days are here again. When FDR was singing that song, then we had a second recession, depression. We're not going to let that happen here. We're going to focus like a laser beam on making sure as we move beyond this COVID crisis, we do it in a thoughtful, safe way. And that means starting with social distancing, hey, dude, keep your distance. I want to hear that wherever I go, when I go to those state parks, as we travel around the state. And we're going to talk a little bit in a few minutes about our manufacturing facilities, safe manufacturing, safe workplaces. Yesterday, as you remember, we did safe stores. This next chart again tells you that, again, hot zones are really reflective of where you are. And I don't have to dwell on this because it's similar to where we were before. But again, Fairfield is ramping up, and New Haven is ramping up the most. And I think you can see the trends from there. Next slide, please. Next slide, again, is hospitalizations. And the top line, you say, what happened, Governor? I thought you were saying we were flattening out. And what that I mean is we're not going up like a hockey stick. It is going up on a linear basis. I think the bottom of that graph is probably a little more reflective for you. It shows you the actual net increase in people being hospitalized on a daily basis. And the fact that that is trending slightly lower gives us in our hospitals the breathing room that we need so desperately. Final chart is, I think you've seen this before, a number of hospitalizations by community. Obviously, Fairfield is still the dark blue and the most at risk. Windham, Tolland, Litchfield County, places where we have more time to plan and more time to focus on the social distancing that will limit the infection rate, limit the community infection, which I hope, I pray, will make those communities much less afflicted a month from now than we've been in the southern part of the state. Just tell you a few other things that I'm thinking about. As we had our unified command meeting this morning with all of the commissioners, 100 plus, virtually online, I think about the number of frontline responders and those that are at risk. And I think about the fact that we need to back them up, not just emotionally, not just with our support, but also the fact that we may need some more people to help back them up. Firefighters, I was told that 99 of them are in self-quarantine right now. And remember, firefighters do about about 80% of our EMS, emergency medical responses. These are people we need. Think about how we back them up. Miriam was saying over Demas about mental health counselors and they get in contact, they have to self-quarantine. And these are people facing businesses. I can't do that by telecommuting. These are the type of people that we have to make sure we keep safe and find ways that we can support them along the way. We've had hundreds and hundreds of people going to 211.org to volunteer, for which I am so appreciative. And we're finding more and more people needs as we go out there. Food delivery. Food delivery, for example, to homeless in our hotels now. We had to quarantine folks into COVID and non-COVID homeless shelters. That means everybody's not getting fed at one place. Seniors. Again, remember, everybody over the age of 60, 65, stay at home. Don't go out shopping. Don't go out to get food. Hopefully, we'll find folks who can volunteer, knock on your door, drop off a meal, do some shopping for you. And one of the things we're trying to do with our volunteer corps, our Connecticut Service Corps, is find more people that will be able to help support those efforts. Not to mention, the thousands of people who are self-quarantining right now, who feel the symptoms, who maybe or maybe not have COVID. They've got to stay at home. And again, these are the type of volunteers that we need. We're trying to find a way to at least get some minimum wage jobs out of this, to get people a little bit back to work and make sure people who are at home can stay at home and stay at home safely. I was talking to Deirdre today, Deirdre Gifford, the Department of Social Services, and she's coordinating the efforts with Uber and Lyft and our taxis, trying to augment our drop-off services, just to make sure people who have to stay at home can stay at home. We've talked a little bit to Massachusetts, and they're trying to put together a group of 1,000 caseworkers. These caseworkers, and we're looking to do the same, would be there to track and monitor folks who have an infection, and be sure to there to we know where they go, who they've touched base with, who they've connected with. So again, we can better track and better contain this virus over the next few months. That's why I continue to emphasize the social distancing. As I mentioned before, we did a social distancing when it came to our stores and how strict we're going to be in terms of enforcing that, enforcing the occupancy of the stores, enforcing how close people can stand next to each other. And we are going out, we're taking a look at that, and we're going to be strict about it. We also are now putting out today, or yesterday, emergency order regarding a safe workplace. I told you how safe a workplace can be in terms of some of our frontline people working for state government. They've got to be people-facing. That's the nature of their job. And I'm just thinking in terms of the safe workplace. Let's start with manufacturing. Start with our defense industry, where we have thousands and tens of thousands of people working, making subs and jet engines, as we talked about before. These are defense industries where we have to keep people there, not to mention the private manufacturing, many of them in the supply chain. That said, we're only going to do that in the safest way possible, and that's why we did our Safe Workplaces order. And most of it is things everybody's already doing, but now it's going to be clear. This is enforceable, and if you don't do it, we're going to tell you so. Number one, you got to self-monitor, you got to self-test, you got to have a fever test, and anybody who registers more than 100.4 degrees does not go to work. No questions asked. So you should know that as an employee, you should know that as a boss. That person is not going to work. And many of our manufacturing, they're doing the testing themselves, at the front gate, at the front door. I was talking to Jim Lurie today at Stanley Black & Decker. They have, 30,000 people in manufacturing around the world, around the country, including Connecticut. They've had 5 infections so far. That tells you this self-policing can work, keeping the social distance, making sure that the cafeterias are not a mob scene, but people separate, maybe have their meal in a car. Making sure between shifts there's a timing to clean, making sure the 2 shifts do not jam at the same time. These are the things that make enormous difference. These are the things that we will be enforcing. These are the things that allow our manufacturing to keep going on a safe basis. And if it's not done on a safe basis, we can't keep it going. I will tell you that thinking about what happens next, thinking about how we can get people slowly, methodically back to work in a safe way. We've had good conversations with my fellow governors, Andrew Cuomo and Phil Murphy, New York and New Jersey. And we're thinking strong about the fact we have a tri-state workforce. You know, our people do go back and forth to some degree, not now with the stay-at-home order, but over time there was that type of transition. So we're thinking hard about what's going to be the nature of our testing protocol. How do we prioritize that? What are the COVID-related tests to see who's infected? What are the plasma or the blood tests that allow us to see who is building up a vaccine, who is building up in immunity? And these are the folks that maybe we can get back to work sooner. And this is what we're going to do together on a group basis. And we want to do this soon so we can start rolling out our testing protocol. I was recently just on the phone with Larry Merlo. He is CEO at CVS, and talking about the CVS testing protocol along with the 15-minute Abbott lab test. And he's got that going in Rhode Island and Massachusetts, and next up is Connecticut. More on that soon, but that will allow us to broaden the mix of tests in a dramatic way and allow us, A, to do the randomized testing that gives us a better idea of what's going on statewide, and then also with the plasma testing, the antibody testing, we'll be able to focus on those key groups that are getting back to work and make sure it's safe for them to get back to work. We're talking to, epidemiologists and healthcare experts like Scott Gottlieb, a Connecticut resident, former head of the FDA, Zeke Emanuel, a thinker and the University of Pennsylvania, folks who are helping all of us to coordinate what's going to be our testing protocol now, as we have another month or two as we reach our surge, and then what's going on afterwards. So over the next months, we know how to safely get people back to work. Flattening the curve works. Flattening the curve has had some initial success here in Connecticut, but flattening the curve only works if each and every one of you take the social distancing very seriously. You know, with that, let me introduce Beth Bai. You know, Beth had the foresight. A lot of other states were shutting down daycare. We urged as many of our daycare to stay open as we could, just to make sure our first responders had a safe place for their kids to go so that they could go take care of us at the nursing home, at the hospital, and hopefully we can expand the group of first responders even more with daycare. With that, Beth? So they could go take care of us at the nursing home, at the hospital, and hopefully we can expand the group of first responders even more. Beth, are you on mute? With that, Beth?
Can folks hear me okay?
Yes, we can.
Okay. Thank you so much, Governor, for your leadership, and to the Lieutenant Governor and Josh Jabal. When you listen, you can hear the daunting challenges before us. I thought I'd start my comments by, like you, Governor, recognizing the people who are forward-facing. Our child care workers have been working each day to support our state during this COVID emergency. They understand what they mean to families and to their communities, and our state is so grateful for their service. We've been working hard at OEC to communicate with families, and I want to focus my comments today on child care. So we've been encouraging families as much as they can to have their children at home or with a trusted neighbor or friend, but we know that's not always possible. So we're suggesting that families who still need help finding childcare call 211 to find licensed childcare in existing programs. And we do still have some capacity in Connecticut. Many programs recognize how important they are to their families, as I said. As the governor said, he did not direct childcare programs to close. Many did close on their own or at the direction of local health. But this was such an important decision, I believe, because programs closed at a rate at which families could then find other options. Some states closed all at once, leaving the workforce, especially the healthcare workforce, without the support they needed to get to work. So we were able to keep a supply of existing spaces, and that's been incredibly valuable. We've also added very specific capacity at hospitals with a project we call Project 26. We now have childcare open at 29 hospitals, emergency spaces for workers who cannot find childcare and have to go to work. And that's been supported by the Dalio Foundation and an incredible amount of work by my agency to open that many sites in 3 weeks. The governor also has issued important executive orders with strict public health requirements for programs that do remain open. Some of the things you heard him talk about earlier. Children are screened on the way in for temperature. They need to stay in small groups, and we've required small programs. So we know we need programs to remain open, but we're also cognizant of the public health challenges, and we're working to reduce the risk of exposure. So as we're concerned about the surge and making sure we have staff for this public health response, we know that supply is critical, and so is assessing demand. So at OEC, working in concert with 211 Childcare and some of our evaluation team at UConn, we are constantly monitoring demand and supply. So we currently have a supply in Connecticut. There are still spaces, and we're constantly checking that. We are also instituting some programs to assure that we have supply. One is the program I talked about at hospitals, where we have programs specifically there. We have 175 children enrolled in those programs, 3 more open next week, and we're working to be ready for a surge. Much like you hear other parts of the response being ready for increase, we anticipate increases to happen in demand, so we're ready for that. We also have family childcare providers who stepped up and have offered some spaces to be ready for that surge. The other thing we're doing is starting this week, we're instituting Connecticut Cares for Childcare. Those are specific funds from the federal bill that are sending extra funds to programs that have remained open. That is private programs, public programs. There are bonuses or funding from $850 a month to $1,200 a month to help support some of the extra costs of being open during the pandemic and assure they have funds for supplies, which they're having a hard time getting, and to compensate staff who are really stepping up at this time. There's information about this Connecticut Cares for Childcare program on our website, the Office of Early Childhood. We're also really concerned about our early childhood businesses. Many of them have had to close. The ones that are open are operating with low enrollments on average. And we want to make sure we have a supply of childcare when this is all over. And they're some of the most fragile businesses in our state. So Connecticut is really recognizing this, and we're working to bring as much information as we can to providers with DECD, SBA, and the Department of Labor. We recognize how important it is that these businesses can reopen because they're part of our economic recovery. It's part of the workforce infrastructure. So with that, I would just close by saying this is a pandemic. It's somewhat unpredictable. Things keep changing. And just know that our team at OEC will keep stepping up and flexing and continuing our efforts to address this public health emergency, to support our frontline workers, our public health workers, first responders with childcare, and the childcare community. We also do all we can to support them. So again, thank you, Governor, for your leadership, and I'm happy to answer questions at the appropriate time.
Thanks, Beth.
And now we will start taking questions from members of the press. We will start with Patrick Scahill from Connecticut Public Radio.
This question is for the governor. I was hoping for an update on the Paycheck Protection Program, looking to see how many loans have been approved for small businesses here in Connecticut.
I can tell you that there have been about $40 billion of loans approved in that first day. And I know that Connecticut got our share of those loans. I can't tell you exactly what they are. I can tell you they are continuing to process these loans right now. There was some speed bumps, I guess, with some of the bigger national banks as they tried to figure out what the protocol and rules were coming down in terms of how this was going to be implemented. And I think they've got that resolved now. So if you haven't gotten your loan in, it's not too late to get your loan in. And this will cover 2 months of your full operating expenses if you keep everybody employed.
And do we have any sense as to applications received or how those applications are being processed in terms of delays?
You know that?
As of yesterday, we're up to $650 million in loan applications in Connecticut, and that's despite the fact that several banks have not yet come online. There's been a bit of a slow start with a couple of banks in terms of accepting and processing loan applications. But by our estimates from our DECD Commissioner David Lamont, we're kind of tracking ahead of the nation in terms of the percentage of loans that seem to be coming into Connecticut relative to the size of our small business space.
Next question will come from Chris Keating of the Hartford Courant. Please unmute your phone and ask your question.
Yes, Governor. Could you tell us a little bit more about the 71 deaths that were mentioned? Was that in a 24-hour period, or does that include other times and catching up numbers, for lack of a better term?
You want to speak to that, Josh?
Hey, Chris, it's Josh Jabal. That's what was reported in over the last 24 hours. Occasionally there can be a lag, as some of the data is reported manually, but the vast majority of that, as we understand, is in the last 24 hours.
Governor, one other point, if I could. As you know, New York and Boston and San Francisco have been banning non-essential construction. Are you considering any changes in Connecticut regarding construction?
Well, as you know, we're keeping our big outdoor public construction projects going, roads, bridges, schools, where it's easier to keep social distancing. We're getting more surgical masks, 3-ply masks, making those available. We're going to get access to them if you're a construction team that's having a hard time getting access to that. I do worry a little bit about the indoor construction if you're in a tight situation. And right now, we're doing that on a case-by-case basis. But if you can't keep that 6 feet of social distancing, you shouldn't be doing that construction.
And I'd just add as well that in the Safe Workplaces guidance that's coming out tonight that the governor mentioned, there will be some additional guidelines specifically with regards to ensuring that even indoor construction sites can be kept safe.
Next question will come from WTIC. Please unmute.
Hi, Governor. Bristol Health came out saying today, due to the decreasing supply and limited availability of testing kits, they're only doing 40 tests a day because they simply just don't have enough tests. Is Connecticut getting more tests, and if so, when?
I can tell you our testing has been generally ramping up over the last week or so. I can tell you we have a couple of new companies that will be greatly increasing our capacity there. If Bristol Health is having a problem with reagents and the such, there's been stop and starts on a couple of the local hospitals. We're trying to keep that flow going.
WTIC News Radio. All right, we will come back to you, close the program, and restart. Next will be Julia Bergman from The Day.
Hi, Governor. My question is also surrounding sort of the testing. My colleagues and I are noticing in our reporting that there are some discrepancies as far as access to testing. Can you talk a little bit about how it's determined who gets tested? And do you have a total number of test kits the state currently has in its possession?
I'll start with that and then hand it over. Look, our priorities are very clear. Number one, in terms of folks who are admitted into the hospital, so we can do some preliminary triage. Who has COVID? Who has to go to the ICU? Who can we, send to intermediate care or another facility? By doing that, we're opening up dozens of beds, because we get people properly allocated. Number two, we're looking at first responders, in particular, in this case, the healthcare workers, those that are taking care of the sick. Make sure they're tested and make sure that they're safe and not infecting anybody else. And finally, we are broadly testing anybody who has that special permission from a doctor that absolutely needs it. Once we get going with the CVS testing protocol, that will be broader. There's a CVS.com site. You'll be able to go to there and see what that you'll remotely put in all your different test cases, and they'll determine electronically, give you a tag whether you can get that test or not. That's probably a week or two away.
We'll go next to News 12, John Craven.
Hi, Governor. So I have two questions that are related about nursing homes, so I'll ask them at the same time. We have a major cluster of coronavirus cases at Golden Hill Rehab in Milford. So first question is, as of today, how many positive cases do we have at that facility? And second, DPH is telling us this case is under investigation. What exactly does under investigation mean?
I'm going to start and hand that over to Josh, but first of all, John, it's really great to hear your voice, and you sound strong, and that's good news for everybody. We're cheering you on. I can tell you that we've got about 38% of our nursing homes across the state now do have an infection. In many cases, more than one infection. As you heard over the last few days, we're being very swift about having COVID-only wings and COVID-only facilities. We'll be announcing the first 3 COVID-only nursing facilities in the next day or so. And that's what we're doing in a very strict way to mitigate the spread of this in a very contained environment with the most vulnerable population. Josh, do you know about this particular facility?
Yeah, hi, John. It's Josh. So with that particular facility in Milford, I think what the reference is to is that our Department of Public Health professionals have been in daily contact with the operators at that facility via FaceTime. They've been on site recently and ensuring that they have the adequate infection control procedures being implemented, adequate staff. And so we're very aware of that situation, and our Department of Public Health is providing a lot of direct assistance.
So, but Josh, what does under investigation mean? I mean, is there some sort of, are you guys investigating possible violations or sanctions here?
No, I think it's more a reference to the assistance that's being provided right now to help ensure that that facility is stable and doing all the right things to take care of its residents.
Let's try to go back to News Radio WTIC. We'll move along next to Matthew Campbell, WFSB Eyewitness News.
Yes, Governor, we're looking to see if there's any information about recoveries. We know that tracking the hospitalizations and the deaths, that's important to paint a picture of where we stand, but I think recoveries could also help clear that up and also give residents hope. So do we have any firm numbers on how many recoveries there are?
I can tell you, looking at the New York folks who have been discharged, I think it's well over 75%. We're going to get those numbers in more detail for you here in Connecticut starting tomorrow. But I think people should understand a few things. The overwhelming majority of people who contract COVID go home 14 days and they're back on the game. And that's overwhelmingly like 99% for people under the age of 50. Obviously, there's a lot more risk for people over the age of 70. Still, the chances of recovery are strong as long as you follow the protocol. Folks over 70 are more likely to be hospitalized. Ventilators, obviously, are one way we're able to keep people alive, and so far, we have enough ventilators that nobody is being denied.
I'll move along next to NBC Connecticut, Matt Austin.
Hi, Governor. I was wondering if you can explain a little bit more about these workplace rules, how you're going to be monitoring companies, what the possible penalties might be, and what employees can do if they have any concerns. Who can they go to?
Well, for the larger facilities, be they manufacturing or construction, we're able to do a drive-through, we're able to see, we're able to self-monitor, and frankly, if employees feel like they're at some risk, they've been able to reach out and contact us or contact the Department of Labor. And when it comes to the smaller facilities, we're less likely to get there on a regular basis. There's a lot of self-policing going on right now, and we do get occasional complaints, and we do respond to them. Right now, the first time out, you're probably going to get a strong warning. We understand that not everybody can get a hold of the 3-ply surgical masks at this point. We're doing everything we can to get those for you, urging employees that maybe their boss doesn't have that as yet. Wear a scarf or a bandana if you feel more comfortable. That's certainly the recommendation of CDC. But if we find it's an environment that's unsafe, we will close it down.
Move along next to News 8, Bob Wilson.
Governor, you said you didn't want to start singing Happy Days Are Here again. You've been planning ahead for the surge for many weeks. Are you planning equally ahead for the return back, the backside of the curve? What would it look like? Do you have any thoughts of who might go back to work first, how you might reopen businesses? And then I had a follow-up question for Beth Bye.
Yeah, Bob, we know about the surge. We know about the peak. We know how important it was to mitigate the effects of that peak in terms of protecting capacity of our hospitals so we can protect you. And maybe we're getting closer to that point. In the meantime, as you say, what's it going to be on the downside? I do worry when I said that comment about happy days, is everybody's going to think we flick the switch, we're out of this, and everybody pours back to work. I think that would be a very dangerous thing. And all the experts I'm talking to have said, be thoughtful about how people get back to work. Start with the least vulnerable populations. Test those least vulnerable populations. Test everybody who's in a critical industry so that they either have the blood test or have the COVID test so we know if they have the necessary immunization. We don't have a vaccine yet, Bob. That would probably get us out of the woods faster. Until then, we have to self-vaccine, and we do that by testing. This maybe will take many months, but we're going to do this in a thoughtful way that gets Connecticut back to work.
And for Commissioner Bye, how are you monitoring the daycares? I know they're going to be critical in getting Connecticut back to work, and it's a difficult situation all around. How are you monitoring for COVID cases, and have you had any COVID cases in the daycare?
I think we need you to unmute, Commissioner
Unmute.
Bye.
I'm sorry, rookie mistake. What we're doing is all the children are screened on their way in for temperature, so to make sure that children are not sick. Most of these programs are fairly new to be open. We did have one case of a child testing positive, but they tested positive before they started and did not expose anyone in the program to the virus. So we work with public health, just like any other setting, that we would go to public health and they would do the tracing if there are cases. We're doing our best. The child care workers are doing a lot of cleaning and hand washing and washing of toys. But we know, nothing is perfect. There's no perfect answer here. But what we can do is create small sites that follow really careful public health guidance that Department of Public Health has worked with us with. And thanks to the funding from the Dalio Foundation and some of the federal dollars, we can provide funds to programs that are open so that they can afford to follow these enhanced public health guidelines.
Move along next to Connecticut Mirror, Mark Pasniokis.
Governor, slightly off-topic subject, the presidential primary. Have you made a decision as to, number one, whether or not you need to issue an executive order for this to go forward in a safe manner? And second, do you support the decision of the Secretary of State to send out absentee ballot applications to every voter?
Yeah, we are actively discussing this with the legislative leadership. Denise Merrill gave us her plan. Bob Clark and Paul Mounds are going over that plan right now. But I'll tell you, we had to put off the primary date to June 2nd, along with our neighbors. I'm not inclined to cancel any type of a vote, and I do have a stay-at-home rule. So I'm going to have to find a way that people can vote, and especially seniors, so they don't have to leave their houses and go vote. So obviously the voting by mail makes a lot of sense to me. Now I need the lawyers to figure out how to draft that, Paz.
Well, have you had a discussion as to how you can get around the constitutional prohibition that seems to be in place on voting by mail, as opposed to perhaps taking a lenient approach to what people can do with absentee ballots?
Let me get back to you on that. But right now, in a pandemic, a real fear for people's health, there is a sickness provision in there. So our lawyers are working through that right now with the legislative leadership.
Thank you, Governor.
Ken Dixon, Hearst, Connecticut Media.
Hey, Governor.
Hey, Ken.
I've never felt more socially distant from you than right now.
I miss you.
Can you or Josh give us the update on ventilators? How many we have? How many are coming? How many we need, please?
Over to you, Josh.
Sure, I can. So our hospitals have been working diligently. We've increased the total number of ventilators that we now have in the fleet across the state to about 1,400. So good progress has been made over the last several days, both bringing models in from out of state, looking at other models that they have that can be adapted for use for COVID patients. And the governor's been making calls to the executives, senior executives of some of the manufacturers as well to try to escalate and prioritize additional deliveries. Ultimately, the number that we need will be dependent on the degree to which we can flatten the curve, right? And so we put out a plan last Friday, or a forecast last Friday that is kind of under a scenario where we wanted to plan for worse, some of the more extreme cases as the governor directed us to be prepared. Our hope is that we don't need that many, but again, we continue to scour the globe to look for more ventilators, knowing that that's most likely to be the primary constraint that we'd have as we look to scale up our hospital capacity.
I will say on the subject of, Ken, on the subject of scouring the globe, I put a real priority on, we have a couple of ventilator manufacturers right here in the state of Connecticut. I feel a lot more confident about their ventilators than what were being sourced over there in China. And I think we'll have some good news on that in the next week or two.
Thanks, Governor. Also, Mayor Ganim in Bridgeport is declaring what he's calling a voluntary curfew at 8 p.m. Every night. Do you think that's a good idea? Have you talked to him about it? Has anybody mentioned anything to you, like in the retail world, about it?
Look, I think that's probably a decision best made by the local municipality. Every town is a little bit different there, so I respect Mayor Ganim's thought that an 8 p.m. curfew makes sense for Bridgeport. What makes sense for Bridgeport may not make sense for Pomfret, so we'll leave that up to local discretion for now.
Thanks, Governor.
We'll go next to Paul Hughes, Republican American.
Hi, Governor.
Hey, Paul.
How you doing today?
Hanging in there, man.
Good. You've talked a lot about the hospital surge, but the death toll has already exceeded the worst flu season that was on record since 2009. So I'm just wondering what steps are being taken to handle what could be an increase in the number of bodies from COVID-19 patients.
What I can tell you about the death rate is it probably lags other indicators, certainly lags the infection indicator by a couple of weeks, 2 to 3 weeks. So while maybe on the death rate you're still not seeing the deceleration we'd like to see, that shows where we were maybe a couple of weeks ago. I think the hospitalization is a more current number. And by the way, we do have capacity there, so everybody needs the ventilators. Everybody needs the ICU is getting that. So I think you're going to see an improving number on that metric as well.
Yes, but in terms of just morgue space and even body bags, are there going to be enough? And what, if not, what's being done to provide those resources?
Paul, we've been in discussion with our hospitals. Our hospitals are making preparations on that topic.
And what sort of preparations are those?
I think it's been widely reported what's been going on in New York, some of the measures that they've been taking to prepare for some severe scenarios. So our hospitals are watching that approach carefully.
So we're talking about refrigerated trailers?
Correct.
Okay. Thank you.
And finally, Sue Haig with the Associated Press.
Save the best for last. Hi, Governor. How are you?
Hey, Sue.
Hi. I was on a call today that Senator Blumenthal had with healthcare workers, And it just seems like there's this common refrain that there are not enough N95 masks. It doesn't matter if you're a visiting nurse or even state employees that are working in places like Natchog. It just seems like there's still a lack of equipment out there for healthcare providers, and they're really afraid. What can be done?
We're at the front of the line for the equipment that's going to allow us to sanitize PPE on a regular basis. I can't tell you whether that's next week or the week thereafter. I can tell you we've sourced the very best N95 masks. Some of them are coming in on a daily basis now, but it's coming in a trickle. And obviously there's a worldwide shortage there. So what I'm doing is telling healthcare workers, we're working our heart out to get this done. We are going everywhere we can. We're going right to the top, going to the senior manufacturers, making sure that we're going to get our share of this. And I'm telling everybody, 3 weeks is too late. Next week is too late. We need it now. We'll take a less now rather than a lot more a lot later. And people got to know, I know how serious this is. I know the risk people are taking. And we're doing everything we can to keep you safe. And I say that to the people of Connecticut.
And we have actually one last journalist, a CT News junkie. Go ahead.
Hey, Governor.
Hey, Christine.
So I'm wondering, in your conversations with the White House and the other governors, have you been clear about how unfair it is that you have to rely on acquisition of PPE and scouring the globe for this without the help of the federal government?
I'd say me and 49 other governors have been quite clear on that subject on a bipartisan basis. And now we governors are taking this into our own hands. We have a regional consortium. We're purchasing from the 6-state region. We're going out there trying to buy. But it's a crazy process. And if the federal government stood up on this months ago, even weeks ago, we'd be in a very different position than we are now. But anyway, the feds have made their determination. They're going to leave this up to the states. They do have a stockpile, and occasionally they're allocating that a little bit. And I've reminded people that Connecticut, I've said this 100 times, I'll say it 101, is part of the regional pandemic, part of a hot zone, and we have to get that spare equipment as well. But that said, let me just tell you, our hospitals are doing an amazing job. And we're beginning to share equipment and share vents and share people between and among hospitals to make sure that we have capacity. And right now we have the capacity. Connecticut is doing it on their own. But believe me, I'm knocking on White House's door every day I can. Thank you, everybody.